Good morning, Joanne. How are you today? Good. Good. All right, Joanne, we're going to do a bed bath this morning. Is that all right with you?
Yep.
All right. First, can I get your name and date of birth?
Joanne Jones, 2/24/99.
Perfect. Okay. And Joanne, are you in any pain this morning? On a scale from 0 to 10, 0 is no pain at all. 10 is the worst pain that you've ever felt in your life. Can you give me a number and rate your pain?
0. I have no pain today.
Perfect. Okay. I'm going to hang this bath in progress on the door so we can get started and we'll be having some privacy. Perfect. All right, Joanne, I'm going to wash my hands real quick. Hand hygiene. I'm going to put my gloves on. Perfect. All right, I'm going to turn the water on here. We got your cups of water, cup of water and cup of mouthwash all set for you. Joanne, I'm going to get you to brush your teeth this morning, okay? I'm going to put your call light over here and your TV remote out of the way for safety. I'm going to sit you up, okay, so you can brush your teeth. Did you sleep good last night?
Yep.
Good. I'm going to help you a little bit here, Joanne, just so you're comfortable. Perfect. I want you to sit up nice and tall so you don't aspirate. I have the gray one, Joanne, is water. The yellow. The pink one is mouthwash. I have your toothbrush all set here with some toothpaste on it. And this one is to spit in when you need to. I will get you a rag so we don't get you all full of water and toothpaste. Put this here. All right. Now I'm gonna get your water and your soapy water, 105 degrees, just so there's no burning, but yet not too cold. Also, if there was an unconscious resident for oral cares, I would lay them down, put them on their side, check for a gag reflex. If there is a gag reflex, I would perform oral cares with a toothette in mouthwash. If there is no gag reflex, I would put mouthwash on it and wring it out so there's nothing in it, and then I would clean on the outside of the teeth and gums. All right. So we've got water. Perfect. Here we go, Joanne. I'm gonna move all your stuff out of the way now since you're done brushing your teeth. Okay, I'm going to rinse all of this stuff out, put it away. Okay, one more. We've got deodorant, Joanne. We have soap, and we have lotion for your back rub. I'm going to set you down, the head of your bed down, all right, so we can take care of you. I'm going to put this in the dirty linens. Excuse me. Perfect. McKenna's going to be assisting me, okay? We want to make sure safety first. We want to make sure that the bed is up so we don't injure our back. Waist level. The highs still go. During unconscious oral cares, we also want to state that we have suction at the ready. Okay. Joanne, we are going to, perfect. We are going to put a bath blanket on you to keep you warm, okay? We're going to take this dirty gown off, and once you're all clean, we're going to put a new one on you. Okay. My bath blanket. Still clean. Help me lift your hand up there, Joanne. Perfect. Awesome. I would take this off, put it right in the dirty laundry. Awesome. Goodness gracious. Make sure that you're all covered and warm. All right, let's take that gown off, Joanne. All right, help lift your arm. Awesome. Perfect, I'm gonna put this in the dirty laundry. Okay, Joanne, we're gonna take the pillow out from behind your head. Perfect. I'm gonna take the pillowcase off and put it in the dirty laundry. So we're gonna change that out. Set your pillow over there. Good deal. All right, Joanne, we're gonna put your shampoo cap on. It's a no rinse, so you would put it in the microwave for 30 seconds. Put it on their head. It'll clean. I'm gonna put this underneath Joanne's head, this towel, for water purposes. Okay, now we have wash rags in the soapy water and the clean water. So I'm gonna take a washcloth, I'm gonna mitt it because we are going to be changing the washcloth position each wipe. Okay. So Joanne, we're gonna work from inner to outer. So and I would normally do the side furthest from me first, but for video purposes, we're just gonna do one side here. So we're gonna work, here we go, warm water, no soap. And we're gonna work from inner to outer, perfect. Now we're gonna wash your face, nose, mouth, behind your ears, get your neck a little bit. Okay, now we are going to pat you dry here. Again, inner to outer, face, neck, behind the ears. Perfect. All right, Joanne, now that you're all set there, we're gonna wash your hands. So I'm gonna take this towel and I'm gonna put it underneath your arm. Help me lift up. Good. And I'm gonna uncover your arm just a little bit, Joanne. So now we're gonna take some soapy water. We're gonna wash the hands. Make sure that there is nothing in there, any food. Perfect. I'm gonna throw this in the dirty linens because hands are dirty. Okay. Now I am going to rinse. Perfect. Awesome. I'm gonna toss that into the dirty linens as well. And now we are going to pat dry. Perfect. During a bed bath is a great time to do a skin assessment. Make sure there's no breakdown, skin tears, bruising, or bed sores. All right, now Joanne, we're gonna get some soapy water. We're gonna wash your arms in long strokes from distal to proximal. So clean to dirty. So wash, 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 wash. Now we're gonna rinse. Squeeze out, rinse, rinse, rinse your armpit again. All right. We're gonna pat you dry, Joanne. Perfect. Make sure the armpit is really good and dry. Awesome. We're gonna put deodorant on. Do you wear deodorant, Joanne? Is that what you'd like? All right, perfect. So we are putting deodorant on. Lift that arm for me, Joanne. Awesome. All right, I'll set it aside. Okay, Joanne, now we're gonna wash your legs and your feet. So I'm gonna take this towel out here. from underneath you. We didn't get it very much wet. We're gonna cover your arms. I'm gonna bare your leg, Joanne. All right, and your foot. Perfect. Great. Can you help me lift your leg, Joanne? Awesome. Okay, soapy water. We're gonna do distal to proximal, clean to dirty again, in long strokes. Changing the washcloth with each stroke position of the washcloth. Now we're gonna get a rinse, and we're gonna do long strokes, changing the washcloth. Perfect. We are going to pat dry, Joanne. Make sure you're real good and dry. Okay. Now we're gonna wash your feet, Joanne. So we're gonna cover your leg back up here. I'm gonna move this down, and we're gonna wash your feet. Get in between those toes. Look for any skin tears, breakdown, mottling, anything like that. Now we're gonna rinse. Perfect. And we're going to pat dry again. Make sure that everything is nice and dry. Okay. John, I'm gonna cover your feet back up. We're gonna wash your back. Can you help me sit up real quick? Yep. All right. Soapy water. Okay, I'm just gonna support your neck here, Joanne. Perfect. And I would do backwash with soapy water. Are you able to hold her? Yep. Okay, and Joanne, you're able to hold yourself up a little bit. We're gonna do water, clean water here to rinse the soap off. We are going to pat dry. Perfect. And Joanne, do you want some lotion on your back?
No, thank you.
No, not today? All right, we're gonna lay down nice and easy, Joanne. Perfect. Okay, Joanne, now we are going to wash your peri area. So I'm gonna try to keep you as covered as much as possible here. Okay. So first we are going to start, I am going to change my gloves before I uncover her. I'm gonna get new clean water, make sure it's warm, 105 degrees. So I've done all of that, and now we're gonna wash you up, Joanne. Okay. So we have soapy water, clean water. We're gonna mitt again, and we're gonna wash outside, outside, and down the middle, and changing the washcloth each time. So outside, outside, down the middle. If it's still soiled, or if there was feces before that, I would have cleaned her up with toilet paper prior, or a wet wipe if the facility supplies it. So she didn't have anything, so we're just gonna make sure that we get everything real clean. All right, we are going to rinse real good here. Get all that soap off. We're gonna do outside, outside, down the middle. And I was changing the washcloth each time. Okay, Joanne, now we are going to pat you dry here. Perfect. Outside, outside, down the middle. Okay. I'm gonna cover you back up. Joanne, we are going to wash your behind, okay? So I'm gonna bring your blanket or your draw sheet a little bit towards me so we don't worry about hitting your head on the side rail. Okay. Keep you covered here. Now reach over towards McKenna. Perfect. Now I am going to get some soapy water. And I'm going to do outside of the buttocks, and up the middle. I would be changing the washcloth with each one. Back to front on a female. Well, on anyone. And then I would get clean water, clean rinse rag. All right, and I'm gonna pat dry again, outside to inside. Joanne, this is where we would put either a brief on or underwear. We're gonna cover her back up so we can afford her privacy and her rear end is not sticking out. We're gonna change your bedding, Joanne. Nice clean sheets. I'm going to fan fold all of this. Make sure we don't get your bath. There we go. We did have one extra towel that we didn't end up using, so I'm just gonna set that as a barrier between clean and dirty sheets. Okay. Perfect. We're gonna put a bed liner down. First, we're going to fan fold it. Make sure, tuck under. Perfect. We're gonna do your fitted sheet. Ensuring none of the clean sheets touch the dirty sheet here. This under there as well, so McKenna can grab it out and you roll back over. And then we're going to do your draw sheet, Joanne. Draw sheet goes from shoulders to hips. Flipping the blankets a little bit, which I did not mean to. Okay, perfect. Fan fold that as well. Sure we have enough on this side. I'm gonna give you a boost. Okay, Joanne, you're gonna come back towards me, but there is a bump, so be careful. Good. Legs coming over. Okay, now you're gonna come towards me a little bit, Joanne. We don't want to hit your head, so we are going to roll. Perfect. All the linens are going into the dirty bin. Okay, Joanne, we're gonna roll you back here. Perfect. I'm gonna put a clean gown on you, Joanne. All right. We're gonna put this here. Okay. So make sure that you stay covered up here, Joanne. Put your hand through. Grab my hand, lift up. Perfect. Good deal. I'm going to tie. We're going to tie, Joanne. And we're going to put it over you. There you go. Good job. You're sitting there on them. Perfect. All right, Joanne. We're going to put your sheet over the top of you. Thank you. Take this black bath blanket off. This goes in the dirty laundry. We're going to put your bedspread on. Good deal. We're going to fan fold the top. as well, so there is not any wrinkles or bed sores under you. Same with the draw sheet. We would have made sure there was no wrinkles in the draw sheet for breakdown. Breakdown can happen in as little as 1 hour. Beautiful. All right, so now we're gonna tuck your blankets, Joanne. We're gonna miter the corner for safety reasons here. No extra sheets laying on the ground. We're gonna fluff the end to avoid drop foot or breakdown on the top of the toes and the heels. Joanne, I am going to get your pillow and put a new pillowcase on it. If the pillow was soiled, I would have disinfected it. I'm gonna put this on. And then put the tags on the inside so they're not touching the resident. I'm gonna leave the outer edge towards the window. Lift your head up there, Joanne. Perfect. Fluff you up there. That's so there's no germs getting inside the pillow. I'm gonna put your bed down, Joanne. Put your head up. Let me know when you're comfortable. All right. Joanne, I have your TV clicker. We're gonna make sure no cords are laying all over the place. I'm gonna clip it up here for you. And then it's right there when you need it. Your call bell within reach. I'm gonna set it right here so your arm's not rubbing on it. Perfect. All the way down. I'm gonna get rid of all my basins and buckets. Rinse everything out. Get all the dirty laundry. I would change my gloves. Joanne, do you want anything to drink?
I'm good, thank you.
All right. Well, you did get fresh water this morning. I've changed it out and I'll leave it right here for you.
Thank you.
You're welcome. And if you need anything, ring your call bell, let me know, and I will be right here.
Okay, thank you.
Thank you.